Divides the body into anterior and posterior sections, belly to back sections. A. Frontal or coronal plane. B. Transverse or cross-sectional plane. C. Posterior or dorsal. D. Mid-sagittal or medial plane. Tendency to gain virulence over time. Untreated conditions tend to get worse, leading to serious sickness or death. A. Pyelonephritis. B. Hemolytic anemia. C. Adenocarcinoma. D. Malignancy. The lab staff holds the head of the laboratory position. A. Medical Director. B. Pathologist. C. Chief Medical Technologist. D. Laboratory Technician. Joint inflammation that is chronic and affects the hands, feet, elbows, and knees. A. Rheumatoid disease. B. T lymphocytes. C. Zymogen. D. Sickle cell disease. Medication for insulin secretion from the pancreas. A. Cirrhosis. B. Tolbutamide. C. Thromboembolism. D. Chyle. What is the main purpose of a medical technologist's work? A. To analyze DNA sequencing data. B. To conduct surgical procedures. C. To interact with patients directly. D. To help healthcare providers make diagnoses. Which of the following therapies can you currently perform at home? A. Changing stoma bags. B. All of the above. C. Changing chronic wounds bandages. D. Dialysis. Clotting condition in which the fibrinogen molecule has a defective structural makeup. A. Fibrinogen. B. Dysfibrinogenemia. C. Uremia. D. Hypoxia. Identifying bacteria by examining their size, shape, and colony morphology on media under a microscope is A. Presumptive identification. B. Differential identification. C. Tachman electrophoresis. D. Numeric taxonomy. RBC that is typically a biconcave disc WOA nucleus. They bind hemoglobin, which imparts red color and transports O2CO around the body. A. Serous fluid. B. Erythrocyte. C. Platelets. D. Nephrotic syndrome. Decreased platelet count brought on by heparin treatment. A. Prothrombin time. B. Lupus anticoagulant. C. Supravital staining. D. Heparin-induced thrombocytopenia. What is required to become certified as a medical technologist? A. Performance of a certain number of lab tests. B. Successful completion of all educational and training requirements. C. At least 10 years of professional experience. D. Licensure from the U.S. Office of Personnel Management. Which of the following is not a form of medicine? A. Wheelchairs. B. Heart valves. C. They are all considered medical technologies. D. HIV test. E. Contact lenses. Who was the first to discover the cell? A. Anton van Leeuwenhoek. B. Alexander Fleming. C. Susumu Tonegawa. D. Robert Hooke. WBC which protect against viral infection or cancer. A. T lymphocytes. B. Fibrinogen. C. Glomerulonephritis. D. Urease. Abnormally low blood count of neutrophils WBC. A. Neutropenia. A. Neutrophil. A. Epistaxis. A. Neisseria gonorrhoeae. Are there online training programs available for medical technologists? A. Only for certain subspecialties. B. Yes. C. No. D. Only for individuals with prior lab experience. Would a truck travel up to how many kilometers on the strength of your heart? A. 6 kilometers. B. 83 kilometers. C. 57 kilometers. D. 32 kilometers. Condition characterized by abrupt kidney failure, low platelet count, and hemolytic anemia. A. Multiple myeloma. B. Purpura. C. Hemolytic uremic syndrome. D. Multiple myeloma. Section 20 of RA 5527 is titled as follows. A. Title. B. Minimum required course. C. Oath taking. D. Roster of med tech. Standardized number which uses prothrombin test results to quantify time it takes to form blood clots. A. Hemolytic anemia. B. B lymphocytes. C. Multiple myeloma. D. International normalizing ratio. Blood coagulation test that analyzes the effects of heparin treatment to detect anomalies in blood clotting. A. International normalizing ratio. B. Acute bacterial meningitis. C. Myeloproliferative neoplasms. D. Activated partial thromboplastin time. How often do medical technologists need to renew their national certification? A. Every 5 years. B. Every 3 years. C. Every 6 months. D. Every year. To avoid making direct contact with female patients, the stethoscope was invented. A. True. B. False. Which of these claims regarding IVDs is untrue? A. IVDs directly treat patients. B. IVDs always come into direct contact with a person. C. IVDs are not used to help determine a patient's treatment. D. All of the above are false. Which modification to the Medical Technology Act of 1969 is the third? A. RA 6138. B. PD 1534. C. PD 498. D. RA 4688. WBC's most prevalent granulocyte form. Most crucial immune system component. A. Eosinophil. B. Neutrophil. C. Thrombosis. D. Neutropenia. Anemia as result of inhibition of DNA synthesis during RBS production. A. Microalbuminuria. B. Megaloblastic anemia. C. Amniotic fluid. D. Pernicious anemia. What types of tests does a medical technologist conduct in clinical pathology? A. Tests on environmental samples such as air and water. B. Tests on body fluids and tissues to look for markers of diseases. C. Tests on animals for experimental purposes. D. Tests on food products for quality control. Which nation employs the most individuals in the field of medical technology? A. UK. B. Germany. C. France. D. Switzerland. The 19th century saw the advent of prosthetics. A. True. A. False. Which of the following is a condition under which a clinical laboratory license cannot be issued? A. Use of expired reagents. B. Permitting unauthorized personnel to perform technical procedures. C. Transferring of results of tests done in an outside clinical laboratory to the result form of the referring laboratory. D. All of the above. The layers of tissue surrounding the brain and spinal cord were inflamed due to germs, and the subarachnoid space between them was filled with fluid. A. Pyelonephritis. B. Peritoneal fluid. C. Thrombosis. D. Acute bacterial meningitis. CSF pigmentation due to subarachnoid hemorrhage. A. Pyelonephritis. B. Pernicious anemia. C. Xanthochromia. D. Aplastic anemia. What kind of examination does a medical technologist conduct in cytology? A. Analyzing the bacterial composition of a culture. B. Inspecting chromosomes for structural abnormalities. C. Measuring hormone levels in blood samples. D. Looking at loose cells under a microscope. Nearer the front, especially situated in the front of the body of nearer to the head. A. Anterior. B. Medial. C. Proximal. D. Distal. Away from the point of attachment. A. Anterior. B. Proximal. C. Distal. D. Medial. The hospital's division that investigates drugs, alcohol, toxins, and heavy metals is A. Toxicology. B. Serology immunology. C. Endocrinology. D. Cytology. A platelet disease where platelets lack fibrinogen receptor alpha 116 beta 3 both qualitatively and quantitatively. A. Pernicious anemia. B. Thrombocythemia. C. Hemolytic anemia. D. Glanzmann thrombasthenia. A colorless result of lowering bilirubin. Urobilinogen is more concentrated in the intestines as a result of hemolysis. A. Pleural effusion. B. Urobilinogen. C. Dysfibrinogenemia. D. Azotemia. What is an additional requirement for those pursuing a subspecialty in medical technology? A. Regular participation in international conferences. B. Founding and operating their own lab. C. Master's or doctoral degree in a specific field. D. An extra 6 months to 1 year of training. Study of features observed with the use of a microscope. A. Cytology. B. Histology. C. Microscopic anatomy. D. Gross anatomy. Reproductive organs: urinary bladder, last section of large intestine and pelvic girdle. A. Pleural cavities. B. Pelvic cavity. C. Mediastinum. D. Thoracic cavity. The capacity of a laboratory refrigerator used to keep flammable, volatile liquids is A. 180 gallons of Class 1, 2, and IIA liquids. B. 120 gallons of Class 1, 2, and IIA liquids. C. 50 gallons of Class 1, 2, and IIA liquids. D. 200 gallons of Class 1, 2, and IIA liquids. Information on the following is provided in Sections 7 through 12 of RA 5527. A. Medical Technology Board of Examiners. B. Examination. C. Certificate of Registration. D. Council of Medical Technology Education. WBC component responsible for combating multicellular parasites and infections. A. Neutrophil. B. Lymphocytes. C. Supravital staining. D. Eosinophil. cancer characterized by plasma cells involved in immune response grow out of control? A. Edema. B. B lymphocytes. C. Neutrophil. D. Multiple myeloma. What is the level of education required to become a medical technologist? A. High school diploma is sufficient. B. At least a bachelor's degree. C. Master's degree or higher. D. No formal education is required. What name is given to examinations that can identify infections, illnesses, or diseases? A. Medical devices. B. None of the above. C. In vitro diagnostics.